Welcome back to the second half hour, The Factor Uncensored. Thank you for staying in there with us. Time after time, we've seen some Houston rappers die or be hospitalized because of health problems. Tonight, we wanted to focus on what needs to be done to keep black men alive and healthy. Dr. Ali, I thought this was an appropriate time to do this segment when we focus in on black men's health, because we have seen a lot of high-profile black men in recent years die in Houston as a result of their health. Some are still alive, but they're still suffering. For example, Big Pokey, we remember him dying on stage with a heart attack. DJ Big Tho, he was a diabetic. It started with his toe being amputated, and he was on the show with you talking about it. Then we later lost him. Of course, way back, Pimp C, sleep apnea, and ESG, colon cancer, and he lost a leg as a result of that as well, and other health issues. And of course, Beat King, who died from a blood clot. When you hear these problems, and mainly they're impacting African-American men, what would be your advice to make sure they get the message to take care of themselves?
Yeah, it's very important. I mean, we have seen this, as you've mentioned, all these artists and rappers that have become ill, and lots of them have passed away. You know, it's so important to take care of your health. We know that African Americans have a higher risk of cardiovascular disease, which means that their hearts, their lungs, their whole vascular blood vessel system is all at a higher risk to have problems as they get older. We also know that they're at a higher risk for diabetes and other medical conditions. And so, you know, the key message, Isaiah, in this is that we need to look at all of these cases, and we need to realize that health is very important, and we need to not take it for granted, right? Mm-hmm. And what I mean by that specifically is to get regular daily checkups, because a lot of these things can potentially be prevented. And if you have a better control of your, for example, like diabetes, you know, we know that Big Tho had a infection in his toe, in his foot, and that because his diabetes was not under well control, that spread, that lack of blood vessel supply there, the lack of nerves innervating that area because of diabetes, we knew it resulted in the amputation. And then eventually the amputation had to go up higher and amputate even more because the poor blood supply and the nerve damage that he had from the diabetes. And so the point in that is that if we can get a better control of our medical comorbidities or medical diseases, then we have chances to live longer, live healthier, and live a better lifestyle versus folks that end up developing these and then they end up having amputations. Or most recently, Beat King, who developed a clot in his lungs. And so all of these things can be better addressed if they're found earlier and treated at an earlier stage of their disease process.
I think a big problem, Dr. Ali, is the fear of the unknown and going to the doctor and getting, you know, some diagnosis that you don't want to get, but it's still important to go just to see where you are. So you have to get past that fear.
That's right.
And I'm trying to talk myself up too.
We're always happy to see you, Isaiah. But having said that, no, you're right, Isaiah. There is that stigma that's there. And I just want to talk to your audience here and say, listen, you know, we're here to help you. The earlier we catch these diseases, the earlier we catch these medical problems, the earlier we can work to fixing that. Because as you've mentioned, and we've talked about Big Tho and others who, you know, had a lifestyle that he was in a wheelchair for an extended period of time. He underwent multiple surgeries. And I hypothesize that if we were able to get to his diabetes earlier, to control his diabetes at an earlier stage, he may not have needed to go through all those surgeries. So think about all those complications, right? So think about all those unnecessary things that we have to do because we waited such a long period of time.
Absolutely. I recently saw Go ahead. Go ahead.
Oh, I
Go
was just
ahead.
saying the other example is cancer, right? We've not even talked about that, but colorectal cancer, if we get some of these screenings done at an earlier phase of our life, then we won't have to catch that cancer at a later stage where it may not be treatable. Colorectal cancer, Isaiah, if it's caught early, it's one of the most treatable cancers out there. And we unfortunately, wait for symptoms or some of those signs and symptoms that are later on in the disease rather than just doing some prophylactic or just screening tests to see if we are either at a higher risk or we have developed some risk factors that put us in that phase.
And make sure you stay with us. We will continue this conversation after the break. Welcome back to The Factor Uncensored. From Beat King to Big Tho, we have seen many high-profile Black Houston entertainers die. Tonight, we continue our conversation about the health issues that need to be addressed in the Black community. And it's also important to remind individuals out there, if you're on a medication for that illness, keep up with that medication. I recently saw a videotape of Houston rapper Slim Thug telling Beat King it's important to keep up with your health. Slim Thug said in that interview, I have been on blood pressure pills since I was in my 20s, and it's important that I keep up with those blood pressure pills and take care of myself and go see the doctor. And of course, many of us, we get on the medications and then we just kind of stop. We think, well, maybe a year of it and it goes away, and it just doesn't work that way, right?
That's exactly right, Isaiah. And so to that point, and I appreciate you bringing this up, because what happens is that we need to regularly monitor whether it be blood pressure medications, cholesterol medications, diabetes medications, and any sort of medication you're on, you need to have that monitored because sometimes you may be taking not enough of that medication, or sometimes you may be taking too much of that medication, right? And so what happens is that, for example, if we're just taking a blood pressure medication, like, for example, if Beat King was, and that medication was not enough, then it does cause damage to your arteries. And over time, you can develop a stroke or a embolism or a clot in your lungs, heart attack. All of those things are possibilities if you're not taking the right amount of medication for that disease that you have.
And just for a matter of accuracy, we said that Slim Thug said he was on blood medication. Beat King never indicated he was, but we do know he died of that embolism, according to family members and management there. Any other words of advice for Black men out there who maybe, and also it may help for you to give us a reason why we see these problems. Is it because of lifestyle? Is it because of genetics? Is it because of a mixture of things that we have so many health issues?
Yeah, it's a combination of all that, Isaiah. Men are generally at higher risk, as we've talked about some of these medical comorbidities. African Americans, and specifically the genetics play a big role. Environmental factors, our health, exercising or the lack of, our eating, dietary lifestyles. So it definitely is a combination of all of that that makes that risk for African Americans to be at a higher risk to develop these comorbidities. So for those folks, it's so important to maintain that balanced lifestyle where you're eating a good meal, eating healthy food, exercising regularly. And the other thing is, Isaiah, preventing some of these things like tobacco use. Cigarettes should be, eliminated as much as possible. Alcohol use should be, limited as much as possible. These are things that all you can do to help yourself, because we know those risk factors are out there. And the other thing is, Isaiah, go get tested, go get treated, talk to your doctor. Again, I call it just a date with your, going on a date, right? Go with that date, on that date with the doctor, go see them, go talk to them in the clinic and explain to them what you've got going on and just feel it out. Maybe that doctor is not the best fit, or maybe they tell you information that will and potentially can save your life.
All right, Dr. Donnelly Shaw-Lee, Arch Point Pain Institute, we appreciate your time on this very important discussion on African-American men's health. We want to keep many of us alive. It's your job to keep me alive. So thank you, sir, for joining us here on The Factor Uncensored.